I'm really excited to introduce our presenters from the Kennedy Willis Center, Brittany Goodrich, Director, and Michelle Banks, Educational and Outreach Specialist. In addition, we have our member relations liaisons that work on our team. They are Kevin Carmen, Shailene Fellows, and Ron Lubier, who will all tell you a little bit more about themselves throughout the forum. They are parents of adult children that are served by our CCO and are available to connect with you one-on-one to give caregiver support, ideas for resources, and other things that you may need. And with that, I'm going to pass it to Brittany and Michelle to begin their presentation.
Okay. Thanks, Michelle.
Of course.
So thank you all so much for joining tonight. We're very excited to spend this next hour of time together talking about how we can offer support and resources regarding caring for your adult loved one. So my name is Brittany Goodrich. I'm the director of the Kennedy Willis Center. I've been in the field for the last 12 years, and I'm currently an independent meeting facilitator and consultant for families and service providers. I'm a trained facilitator with Second Wind Dreams, the virtual dementia tour, and also an affiliated regional trainer with a national task group on intellectual disability and dementia practices.
My name is Michelle Banks. As Kate said, I'm the education and outreach specialist at the Kennedy Willis Center. I have about 17 years experience in the field. I'm a former house manager, a former residential team leader, and an adult day services manager. I deliver person-centered trainings and dementia-specific trainings. And similar to Brittany, I am a Second Wind Dreams virtual dementia tour facilitator and affiliated regional trainer with the National Task Group on Intellectual Disability and Dementia Practices.
So I just wanted to tell you a little bit more about the Kennedy Willis Center. We are located in upstate New York in Otsego County, and we're a resource center that provides best practices in the areas of training, research, education, and program development for individuals, families, and professionals in the disability community. We have partnered with LifePlan CCO starting back in 2021 and recently expanded our partnership to include ACA in 2024, so this year. And the center mainly provides a comprehensive package of support and services for members that are facing age or cognitive related changes.
Sorry, my buttons disappeared.
Okay. So the main objectives, the three things that we hope to accomplish today in the forum is to review current statistics of caregivers and current components of caregiving. We're going to discuss caregiver strategies and supports, and then we are going to share some available caregiver resources. So I want to put a little disclaimer out about caregiving because there are so many different types of caregivers. There are many different types of functions of caregiving, but for today's purpose, we're going to define caregivers as non-paid support that provides care for adult loved ones with intellectual or developmental disabilities. And we're going to modify some of the strategies and the support that we offer you, again, that is going to meet the needs of our adult or our aging adult loved ones for today's purposes. So I wanted to first do like a little bit of a broader scope and looking at some of the national statistics of caregivers. From a 2019 ARC report, there are currently 7.3 million people with intellectual or developmental disabilities that live in the United States. And that number is likely to increase for a variety of different reasons, mainly because life expectancies for people with IDD are continuing to increase, which is great. And with increased life expectancies, we know that there will be more and different type of care that's going to be needed across their lifespan. Currently, out of that 7.3 million people, there's 80% live with a family caregiver. And nearly 1 million households in the United States include adults with IDD that live with and are supported by an aging caregiver. 63% receive at least one type of Medicaid-funded service. So there is a really large economic value of unpaid caregiving that's happening across the United States every single day, and that's estimated to be over $470 billion. And despite many states demonstrating an increased availability to different resources and public funding, there are some significant barriers and gaps that continue to exist across access and accessing services and delivering of services. In New York State, so if we narrow down a little bit more specifically to where we're living, 84% of the caregivers are women, 68% of New York State caregivers are at least 50 years old, 22% are over 65 years old, and 20% are providing care to someone that's living with dementia. And also a majority of the family caregivers in New York State are holding separate full-time employment, which we realize you all are wearing many different hats, but this really speaks to that for sure. So we came up with just a little infographic that we thought really spoke to the key components of caregiving. And we know that caregiving in each situation is different and unique. And the components on this graphic may be more significant for your family now, and they may change in the future as the needs of your family change or the needs of your loved one change. But Michelle and I are going to spend the next time with you to discuss these components and give you some helpful strategies that are going to help you continue to care and give great care to your loved one. And we hope that what we share today will be helpful, and both now and I guess and in the future.
So first we'll talk a little bit about personal care. We know that assisting with personal care can be difficult, especially as a person ages and especially if they have been very independent earlier in life. However, there's a lot of different ways that we can assist the person to remain as independent as possible for as long as possible. So some of these include using visual cues. So that could be things like labeling dresser drawers with the items that are within that drawer, or it could be the use of a daily schedule, whether that be like the one on the screen where you Velcro, done, to do and done, or maybe a check mark, whatever it may be that works for your loved one. It can be really helpful to simplify the language that you're using. So, try to keep it simple, be clear, be concise, avoid using those more complex sentences, and avoid using things like sarcasm or slang that might not be easily understood. Being flexible is one of the best strategies you can use when caring for a loved one. Be willing to change your approach. What works today might not work tomorrow, or maybe we skip washing the hair today. We'll take care of that tomorrow instead. Setting up the environment in advance can be really helpful, especially for more intimate care, like in the bathroom when you're helping someone for a shower. It could, if you set that up in advance, it gives them the cue that it's time for that, but it also makes the environment a little bit more inviting. So things like turning on the water before you get in there so that the room can be warm, making sure that you have all of the supplies that you need for the shower before you start the shower. And really, something simple like turning on music can really make a big difference for people. And then different types of adaptive equipment. Adaptive equipment can be really beneficial in helping a person remain independent because it takes out that extra person. So, for example, medication dispensers, they have these really cool dispensers that won't open unless it's time for the medication, and it'll only open one time so that the person can safely take the medication that they need to take without over taking medication.
So for the second component of housing, this is really just to give you some I guess, helpful hits and strategies to think about where your loved one is living, and maybe not just now, but where they may be living in the future as they continue to age. So it's likely that your loved one is living maybe in a different place than someone else. They could be living at home with family. They could be living maybe in a group home type of setting, maybe an apartment in the community. So there's a variety of different options that are out there that meet your loved one's need. And just keeping in mind opportunities to continually evaluate the home environment, making sure that we're focusing on things like accessibility and orientation. Is the person able to navigate the home and get into the home, and get out of the home safely? Is it comfortable to them? And where are opportunities to maintain independence, like some of the ideas that Michelle just shared? And we want to try to leverage as much available waiver and community resources as possible. So for different types of settings, non-certified settings, there's a variety of different modifications that may be available to you. Things like environmental modifications, vehicle modifications, or assistive technology that could be accessible to help change the environment so your loved one can remain in place longer. Environmental modifications may be things like putting a ramp into the front door. Could be things like installing a roll-in shower for easier bathing. It might even be things like a strobe light smoke detector that's helpful for somebody in the evening time, or maybe that's hard of hearing. Things like vehicle modifications could be incorporating lifts or different equipment that might keep a wheelchair or different pieces of equipment in place while the vehicle is in motion. And assistive technology is really any type of tool that would help maintain daily living skills or a health-related task. It could be a computer or software app program, any type of technology device. And just keeping in mind really the consideration that your home is a place that you may want your loved one to stay, and they may want to stay in for forever, but it may be that the needs may change, and you want to look at that and keep that in mind as the support level changes. And Shailene, I knew you had a comment that you wanted to add.
Maybe not.
Not at this time.
Okay, thank you. So we'll go on
I
to the
think
next slide.
Shailene definitely has some great stuff to add, but she's going to add at the very end after the presentation.
Okay,
So,
all right, thank you.
Yeah.
So keeping in mind some of the different considerations, Michelle and I thought it would be helpful to put some pictures up of some different layouts options. These pictures on this slide and the next slide come from Enabling Environments out of Australia, but it's a really wonderful website. It will be listed and available on the extra resource page that we provide at the end of the PowerPoint. And you can go on there and you can look at different types of layouts for a home, group settings, apartment, or different types of care facility settings that modify maybe where your loved one is living, to think about considerations that impact age and cognitive change. So a couple just key things to think about in our home, again, as we're thinking about accessibility and comfortability and safety. Flooring, lighting, and wayfinding cues are kind of the top categories that Michelle and I thought would be important to share. When we're thinking about flooring, surfaces obviously that are clear from obstructions and not super cluttery are important to think about. Avoiding busy patterns or dark colored surfaces, as well as high glare surfaces. Maybe if it's a light colored floor with a lot of overhead light that can be reflective, can make it difficult for your loved one to see as they age. And also keeping in mind the durability and the upkeep of the flooring as a caregiver, keeping all of the rooms clean and upkeep, you want to make it as easy as possible. For lighting, as we continue to age, and specifically for people that experience dementia, 30% more light is needed. So when you're thinking about the home, keeping those lights on, opening the curtains, and having the natural light come in is a great option. And also considering the installation of maybe motion activated lights. Those in the bathroom are really great. Even a little night light. Again, as we're getting up in the middle of the night, we have one less thing to think about because the light's going to come right on for us or for our loved one, and just makes things a little bit easier. And the last consideration would just be incorporating maybe some clear or easily visible types of labels or cues, which may feel silly, but as the person continues to age, again, we're taking that confusion maybe out of the home and where, what door goes where. Maybe putting a picture of your loved one on their bedroom door so they're remembering where it is. Maybe labeling some of those drawers or other things so they can continue to access those by themselves. The next slide is another slide from the Enabling Environments website that we thought was important, just because it related to the personal care component. But the bathroom, again, a lot of just non-reflective type of flooring would be recommended. Other simple to change things like adding or changing out the doorknob for a brighter color, maybe a lid on the toilet seat that's a little bit more easily recognizable, and making sure that our personal items are accessible instead of being put away maybe in a cupboard or below in drawers. Leaving those out for your loved ones to be able to access readily would be a great idea.
And so we'll talk a little bit about social engagement now. So you'll see there's a beautiful chart on your screen. It does say spring activity ideas. That's just the season we chose because we love spring. Obviously, this could be for any season. So really offering your loved one choice based on their interest, but really trying to, include a friend maybe within these different areas. So, things like physical exercise are really good for us. And that can be something so simple, going for a walk with a friend, playing balloon volleyball, just having some, dancing a little bit to some of that music, different sensory type activities, things that can be very simple, especially this time of year with all of the flowers and the gardens and everything. So enjoying time with those types of things. Social interactions, again, that can be a multitude of things. Something simple like playing a board game or having coffee with a friend, even going to the library, which is a free resource. We always like things that don't cost us any money, right? And then some cognitive engagement. So things that really get the brain working and get the brain thinking a little bit. So that could be things like puzzles or sorting, doing something fun like a scavenger hunt. Those can be seasonally based too, which is always fun. But really utilizing those local community resources as much as you can. Like I said, like libraries, animal shelters. A lot of our local schools have really cool events that they put on, and they are usually either free or low cost. So it's worth looking into some of your area resources.
So we're going through the components still, we're working through. We wanted to touch on decision making a little bit. I understand that there was some previous webinars that may touch on this slide and the next slide. So I just wanted to highlight a couple thoughts that we had that may be beneficial. Understanding that there are many different ways that we all make decisions and that the level of support for decision making is different for all of us. I thought it would just be helpful to kind of break up some of the differences between informal decision making and formal decision making. Informal are things that we all do every day, whether we realize it or not. It may just be asking a friend or family member for advice. I know I heard so much and learned so much from the family liaisons about, using their network, using their friends, using people that are here in this group right now to share ideas with each other. And I think that's probably some of the best advice that you could have is learned experiences from other family members. But there are times that maybe more formal decision-making support is necessary, and that would be done through various professionals at that time when it's ready or when your family is looking for those types of needs. But I think the last thing I really wanted to mention about decision making is just please continue to plan for both the expected and the unexpected. And that's things like even yourself as a caregiver, as you continue to age, who else is maybe in that supportive role for your loved one that could be beneficial to help? Is it a family member? Is it a friend? Is it someone in the community that you trust and that your loved one trusts, that you should start having conversations with to loop in, just to prepare for everything that's to come. And in terms of healthcare, just some considerations about long-term healthcare needs, especially if your loved one is going to continue to live with you, or maybe in a non-certified setting. Things like durable medical equipment, home medical supplies. We're going to talk a little bit about lending closets. I know Kevin will talk about the ready-to-go binder in a little bit. I just wanted to mention the durable medical equipment, and that's really things like your walkers, wheelchairs, maybe hospital beds, commodes, CPAP machines, those types of things would be the durable medical equipment to think about. And the home medical supplies would be different types of supplies that would just be used one time. Maybe adult incontinence products, it could be ostomy care products, it could be diabetic test strips that you've used and then you toss. And I know that these things can cost a lot of money and it can be very expensive and stressful to get these things as a caregiver. I think one of the best things that I have learned just working professionally, but also meeting with a lot of different families, is the recommendation that they had is to continue to really lean into your adult loved one's primary care physician. Going back to them, especially if there's certain types of medical supplies that they're recommending or things that would be more helpful for you at home as a caregiver, please go back to them and ask them to write a detailed script for you. They will do this, and it could be things like listing out maybe how much of the product or the supply is needed in a month. It could even be as specific as what type of brand they would like you to use, because we know that sometimes we may get support or we may get the products that are a little bit lower quality, but we end up using 2 or 3 times the amount of the same product. So trying to ask for the exact thing that you want, they may write that on the script and it may be something that could get covered. So I just wanted to mention that briefly. And also really leaning into your local county resources or other community resources in their lending closets, which if you're not familiar, typically run out of community-based providers where families are able to access different types of medical equipment or sensory equipment on loan before having to purchase something out of pocket, which is really great because there's many times where you may think something's going to work well, or your family member may really like something and you get it and they don't, and you could be out of that money. So a lending closet is a great resource. And Kevin, did you want to speak now or did you want to wait till the end?
I can wait till the end.
Okay, thank you. The last just a couple of pieces under healthcare was really just to, again, just like the other pieces with decision making and what we'll talk about with financial planning, is try to anticipate the changing needs. And I know we don't have a crystal ball, but thinking about maybe what could happen is a good strategy, and thinking about what someone may need in the future is really important.
So am I ready?
Oh, sure. Yeah.
Oh, I'm sorry.
Thank you.
Okay, so my name is Kevin Carmen, and I've been a liaison for 5 years, and I've loved every minute of it. I love working with our liaisons. We can troubleshoot. We can come up with different ideas. So nice having a group of people with similar situations, and like was said before, is we all have been parents of children with or caregivers of people, of children with special needs, adults with special needs. And so so my son was 26, and he had a lot of health conditions, and he had he had IDD. So we were in the hospital a lot. We were at the doctor's office a lot. He had many doctors, and what we grew to realize that we needed was a binder. Now, a lot of people will say, oh, we have to carry a binder all around. Well, that's what we did because we had a lot of stuff, but there are ways that you can do that. You can also keep a notebook that has, you could do a small or medium size. You can put it in the pocket of the back seat of your car, or in something protective in your trunk. And the reason why I say that is because there are times where you go to one doctor and it turns into 3 doctors, or they say you need to go to the emergency room, or they say you need x-rays, or you need blood work, right? Now, if it was anything like my son, there are a whole of things that go into getting you to a hospital or a doctor, right? So, we had a notebook, but we also had a buzzy, which is something that hits the skin and creates a vibration and makes it easier to get blood work. We had like a stuffed animal. We had a small blanket. All those things that you might need, we always had in our car. We also, and that's just emergent, but it's good to have when you're going to a regularly scheduled appointment. So the reason why I say the binder is because we all may have things on our phone, right? Like updated appointments or updated medicines and things like that. I will tell you, a lot of doctors are very uncomfortable with people carrying their phones around. So it has always been, if we have that binder, if we have a notebook, we can either take more, new information in, or we can hand out. Now, this is not to say that you give everybody all the information, but you can have a couple of sheets ready so that you have medications, you have maybe the way to talk to your loved one, because we all have different ways, we're all have different anxieties and different ways that we need to be made more comfortable. And then it's always good to have a sheet. We always had that with updated information. Now, we had many doctors and they didn't all talk to each other. So we always had a sheet that we gave to every doctor about what was happening at those other appointments. Because there's always a magic moment when you go into the doctor's office and the nurse comes in and says, okay, why are you here? What's been going on? Did you have any change of medications? And this is where you can put that all in so that everybody has talked to each other, And the other thing is that then you're inviting them to be a team member and you're explaining to them what you need to help them to be supported and help support your loved one, right? So, and then you have, as our son got older, it was very apparent that, our voice was diminished. And as we all know, as parents and caregivers of adults and children, our voice needs to be heard more because each individual is very different. And hospitals only see one part of a patient. They do not see the whole picture. So it's our job to do that. So, make sure that you have a copy of your guardianship or health proxy or anything that would help you communicate with your doctor. And I will also say with the hospital. So we've talked about planned and unplanned, right? Because that notebook in the car with all the things that make your loved one more comfortable is important to have because we never know, right? So you're in the hospital and your loved one special things that will help the visit be better, right? So it's now you can access child life specialists, and sometimes they will meet with you if you have an older child. There's also hospital advocate. Always good to ask for the hospital advocate because there's also times where you might need to go to the X-ray, have different imaging, and as in our family, my wife always went and was always present, and there was always an issue. So as long as if you have a paper saying these are the expectations, then you have an advocate that will say this is what the parent wants. And so it just makes it easier for doctors and nurses to support you because they have all the information, and they don't have to have it all. There's certain things that you can give them, like like we say medications, right? So if they have a med list, well, there are a lot of things with that med list that's just not medication. The person might need applesauce or might not want applesauce or might want a piece of cheese, or you know what I'm saying? There are specialty ways that hospitals won't consider. But if you have it written down, the pharmacist has to recognize that. Or, I say has to, but we can encourage them to want to. Um, so, and this will all help you be supported, feel supported. And if you're prepared, that's a really nice place to be, because we all know that we don't always ever feel supported, right? I mean, there's always something we haven't done. There is something that we need to do. And the more that we can help others help us, the better off we are.
Thank you so much, Kevin. I do want to pass it back to our presenters too, because I don't want to take up too much of anyone's time going over. But Kevin's going to answer some questions at the end too. So if you have any more questions about that, hang on to him, and I'm sure, would be so happy to answer.
Thank you, Kevin. And continuing with just going through the rest of the components, just as Kevin had said, how important it is to prepare. Financial planning is another one of those important pieces to prepare for. Many times I meet with families, there is a conversation that alludes to, I don't have enough money, I don't need to do any financial planning because I don't have enough money to do this. And I wanted to let everyone know that financial planning is absolutely for every one of us. And it's important for all of us to consider and to think about whether we have a little bit of money or a lot of money. So I really wanted to kind of rest assured that you can start at any place that you are and take small steps to put some things in place that maybe your loved one needs in the future. I listed 4 just brief steps that I thought were, for me, easy to remember, easy to share with others, that can help us think about financial planning and oversight. The first is really just to identify and prioritize our goals. That is going to really drive how much money or how much resources we're going to need. So that's important to think about what the needs are both now and in the future. And then you're able to develop a list of the resources. That may be both your private resources and the public benefits that you could have your loved one take advantage of and incorporate into their life. When you get to that point where you feel like you kind of know what the plan is and maybe you know what the goal is, meeting with a professional is always a really great recommendation. Ensuring that that's someone that works maybe at least in the state where your loved one resides is important, so they're aware of some of those legalities and other types of regulations. And then continuing to monitor and review your plan. Even if you've already got a plan in place, even if you already have, a trust or different things in place, it's always great to go back, continue to review and monitor, and also to share that information with important people, attorneys, other family members, things like that. The next little piece I wanted to add was just to try to, if possible, maximize and diversify your assets. Again, thinking about you don't have to do it all. There may be many different types of benefits that are available to you, public benefits that are available that can offset some of those needs. And there are many different ways to protect benefits. And I know we could probably talk an entire presentation on these different types of ways, but I just wanted to list a couple that were available, such as special needs trusts. Really just a great way to protect the beneficiary's eligibility for public government benefits, things like Medicaid and SSI. ABLE accounts are really like savings accounts that can cover some of those quality disability expenses, things like housing, education, transportation. And then there's also an option of a pooled income trust, which is another way to protect assets. And it can allow people to really lean into different nonprofits that are typically the ones who manage those. They can help set up automatic bill pay or distribute funds for your loved one. So to take some of that stress off of you.
All right, so now let's talk about caring for the caregiver, right? So we know caregiving can be stressful and we all feel it, but it's important to take care of you too. You have to take time for yourself in order to take care of someone else. Remember, you can't pour from an empty cup, so fill your cup. Right? So first, some of the challenges that we see. Caregiver well-being is a huge one. So it does have a health impact. Only about 38% of family caregivers reported good health. with 70% reporting adverse mental health symptoms and 55% reporting anxiety and depression. 94% of caregivers reported some level of stress. I'd like to argue that 6% it was a good day when they asked because we all feel some level of stress. Some of the most commonly reported symptoms that caregivers report are things like anger and anxiety, social withdrawal and isolation, depression, maybe sleeping too much or sleeping too little, and a lack of concentration because you're spending so much time worrying about your loved one, you're unable to concentrate. So taking care of yourself is really important, and we can do that in a multitude of ways. Physical activity is really good. You know, even just that simple, short little walk, anything to just get a little bit of movement, it'll help you feel better. It'll help your energy level. Regular medical care. So, you know, we just had a whole little few-minute conversation about how important medical care is for our loved ones, but we tend to forget about our own medical care and our own mental health care, right? We forget that we also should see the doctor every year. We should also follow up on certain things and make sure that we get our lab work done. So making sure that you're doing those things for yourself as well as for your loved one. Having a healthy diet, so staying hydrated, follow that heart-healthy diet. It'll be good for you and good for your loved one. Engaging in hobbies is really important. So maintaining a hobby that you've had for a long time, or maybe finding a new one, right? Maybe you'll learn that you surprisingly love gardening now and hated it before. So who knows? Try something new. Spiritualness and mindfulness. So if you are a churchgoer, you know, making sure that you continue to attend church or other spiritual gatherings, or maybe, you know, smaller group sessions, or just journaling, spending some time reading and really thinking about that mindfulness. And then a support system. We need our support system whenever we can, right? And that could be something as simple as talking to your best friend about the stress that you're going through. Or maybe it's talking to some of the other people on this call, right? Like really finding that niche, finding your people, right? Things like coming together to talk about, because you have similar things going on. So it's easier when you're chatting with someone who knows what you're talking about, right? So here are a few little stress reduction techniques. I know some of them you may laugh a little bit, but it's okay. They really are beneficial. So things like visualization. So simply, you know, taking those few minutes to picture your happy place, right? That peaceful, calm, happy place. I'm sure most of us, it's on the beach with the sun shining, if that works for you. Whatever that happy place is for you. Meditation can be really helpful, even if you're only taking 5 minutes to really sit and let go of those stressful thoughts and participate in some mindfulness activities. You know, just taking those few minutes for yourself. Breathing exercises can be really helpful. Again, I know it seems a little silly to, I'm going to sit here and breathe in and breathe out, counting all of it. It really can make a difference. Progressive muscle relaxation can help too. And that's just the simply tightening and then relaxing each different muscle group. Maybe you start from your head and move down to your toes, vice versa, whatever works for you, but just having that, being very sure about the tightening and the relaxing. And then simple things like counting, you know, sometimes we need those 10 seconds to count to 10, right? Or simply just listening to music that's calming for you and can help you to, you know, reduce that stress a little bit. So these are a couple of statewide and national caregiver groups. If you're interested in looking into any of those, you'll see these resources later. Facebook does have many helpful groups. So just, take a look around and see if anything interests you and you can kind of find that group that works for you. These are just some additional resources for many different areas: physical health, engagement, caregiver wellness. But again, you'll get these when you get the materials.
Yeah, and I think we're just going to end before we have, the liaisons. I want to give them enough time to share their feedback. I just wanted to let everyone on the line and anyone listening to the recording later know of the available services to you. And this is part of our partnership with LifePlan and ACA. You are welcome to call Michelle or I anytime for questions, resource, help, support, strategies. Please call us. That's what we're here for. You would be able to access our e-newsletters, which would come out through the marketing departments here. They're typically electronic, but we can also mail some if you would prefer a hard copy. And we offer a variety of different aging and dementia-related resources, such as baseline assessments, webinars such as these, and can even attend a life plan meeting if that would be something that you or your loved one or the care manager would be interested in. We do also provide some support with some environmental site reviews. So looking back at the home, the living spaces, maybe even the program spaces, if there's things that are of a struggle or a challenge, we'd be happy to come and look at those. And because you guys are maybe a little bit further from us, we can also do a lot of these things virtually. So please, again, let us know if there's anything that we could help with. We'd be happy to.